Desktop version again of PebblePad. So if we go to our resources and we go to the ROC dental sedation nursing again. Now the PCAS, we completed PCAS IV sedation treatment 1 before. So you see if you log in, it shows all these bits. See here, it said it was fully evidenced there, but it's not. That just means that you've uploaded your witness assessment sheet, which we haven't. It just said that because I trialed this a few times. So here, when you log in and go to your PCAS one, the one you just completed, it will say this has not been evidenced. So what you do, you click on the arrow here, click add an asset, and the asset you just completed on your app is PCAS 1 IV treatment, because that's what we called it. Just click on that and done. That links it. That's all the evidence you have to submit. So it means you've completed your PCAS form, your witness has filled out your competences and signed that you're competent. You just click this item is now fully evidenced, top left, save, and then everything that's fully evidenced then becomes available for us to see. So say as you complete these, once you've completed 5 of them, say, we'll be able to see that you've completed 5 and you're well on your way to getting your cases done. Now for all of your IV sedation cases, you'll have to do a treatment and a recovery sheet. Sorry, the recovery sheets are only for 5 of your intravenous sedation cases. But I just get them out of the way from the start, so try and just do a sedation treatment and recovery sheet for everyone for your first 5, and then you don't have to worry about doing the recovery sheets afterwards. The recovery sheets you can just fill out. It's fairly straightforward. There's not quite as much on it as the treatment sheets. And again, your witness assessment forms will be completed just as a PCAS standard form. You will call it on the app PCAS, whatever number it is, say 1 or 2, IV recovery rather than IV treatment, just so you can find it easily. Say if you've saved quite a lot to your assets here. And then just to add it again, this has not been evident, so you click the arrow, add an asset, and it will show up here if you've completed it in the app. So it'll just come up as PCAS 1 IV recovery. Just click on it, and when it's out, it'll add it onto here. And then you can just say this is now fully evidenced. Save, and again that comes through to us. And same for your inhalation sedation here. All the details are pretty much the same. There's a bit less to record than on the IV sedation ones. Nasal hood, size or type. So that would just be, say, small, medium or large. It's just a little nasal hood that the patient wears. Type you can put, because it might be like a Porter Brown one, for example, or a silhouette mask. There's lots of different ones, so it's whatever brand you're using in your practice. So say Porter Brown medium. Average flow rate, so it says you learn all this from your theory, but litres per minute. So the average flow rate would usually be about 6 to 8 litres per minute, and that's just adjusted by the dentist depending on, you'll be watching, say, the reservoir bag, and it depends on the patient's breathing, and it will depend on their lung capacity as well. So you just put 8, for example. Maximum concentration of nitrous oxide. Usually you'd be titrating up to sort of 40 or 50%, so just the percentage of nitrous oxide that is. The duration of sedation in minutes, so the duration of the treatment appointment, say 20 minutes. Sedation scoring, that we know from before, and operating conditions that we know from before. And then patient behaviour, say calm, relaxed, agitated. Discharge indicators, so you might say Eve's sign was met. Just when a patient can sort of touch the nose. Essentially, you just need to say patient can walk unaided and feels okay to leave. Obviously, if they're children, they'll be leaving discharged to the care of their parents. And if they're not children, then you would probably usually keep them an extra 5 or 10 minutes, especially if they're driving home, just to make sure that they're perfectly fine to go. You've given the post-sedation instructions, any difficulties you incurred, and then that's it. And then here again, on your app, you would complete another PCAS form. You would title it Inhalation Sedation 1 or 2 or 3, depending on what number case it is out of your 10. And then your witness or mentor would sign off that you were competent. You'd submit that, so that would now be in your assets. Click on the arrow here, add an asset. It'll be sitting here, so you just add it in. And that is all you need to evidence that. So this is now fully evidenced. Click, save, and it comes through to us again. So that's it for your PCAS forms. It's exactly the same for your docs forms. So your docs, you will need to complete 5 of all of these. So for automatic blood pressure checks, pulse oximeter use and checks, given the patient intravenous sedation instructions, all of these you have to complete 5 of each. So really, there's quite a lot to do, so I would just try and get them all done for your first 5 cases. And then you don't have to worry about completing any more docs then for each case. Obviously, you'll be doing it each time, but you would have completed your required docs. So say, click on automatic blood pressure. So you have to do 5 of these. So we click on it. Delete that because that will just be one that I added earlier. So it will look like this. This has not been evidenced. Clinical skill observed. Just click on the one it is. So patient's blood pressure. Candidate name. So that's your name, your GDC number, date of assessment, case number, say number 1. That's it. You don't have to do anything more on there. The rest is on the witness assessment form. So on the app, you would click not on the PCAS witness assessment form anymore, but the relevant docs one. There's one for each of these docs. So there'll be one for each of these. So go into the app, click on docs for blood pressure, and then your mentor, your witness, will then complete that, say you're confident, sign it, say what can be improved, and then submit that. That will then put that in your assets. And when you come back to this later on, you just add the asset. So say if this would be docs blood pressure, you'd save it as, or docs 1 blood pressure, just so you know the number. If you were saving quite a lot before then coming back onto PebblePad to upload all of them. There you go, that's linked. Items now fully evidenced. Save, that comes through to us. So the PCAS forms, all of those, so it will be 20 IV sedation treatment ones, 5 IV sedation recovery forms, and 10 inhalation sedation PCAS forms if you're doing inhalation sedation and IV sedation. For the docs, you have 5 of each of these. And then that's it for what your mentor witness needs to sign in terms of the witness assessment sheets. The case studies, you just complete yourself and then submit to us. Supplementary outcomes, you just submit yourself and they come through to us. So say this one, emergency drugs, just list your emergency drugs. Once you've listed them all in the medical emergency, therefore, these would be the emergency sedation drugs plus the other emergency drugs in the practice, and just save. And that comes through to us. Same for all these supplementary outcomes. So just read through them all. They're fairly straightforward. And each time you submit them or save them, once they're complete, they just come through to us again so we can see that you've completed them. So that's your PCAS is completed, 2 case studies done, all your docs forms completed, supplementary outcomes completed, and your tracking documents will track how you're coming along with your cases. So it'll let us know that you've completed your PCAS forms, and we'll put some notes in if we need to, completed your case studies, and completed all the docs, it's all satisfactory, and supplementary outcomes. So it will say when all of this is complete and sampled by the internal moderator, then you know you're complete. But don't worry too much about that. You don't fill anything out on this page. It just say as you complete each part, and we have reviewed it all and it's all been sampled as it should, then it just shows as this is complete rather than in progress on here. So we can talk more about that later on, but as far as you're concerned, just read through your introduction and then complete your PCAS forms, your case studies, your docs forms, and your supplementary outcomes. And any issues at all, just email us.